In previous videos, I talked about the 7 types of bipolar disorder. This video is for what are called specifiers, which are descriptors that can be added to a diagnosis of bipolar disorder to provide additional clinical information to inform treatment planning. Specifiers are not diagnoses in and of themselves. The DSM-5 lists 9 clinical specifiers for bipolar disorder, as well as specifiers related to severity and level of remission if present. I'm only going to review a few of the specifiers in detail here, though. So the first one I want to talk about is with anxious distress. This is added if someone endorses 2 of 5 anxiety symptoms in a particular list, such as feeling keyed up, tense, restless, having problems concentrating because of worry, feeling a strong sense of foreboding or something bad's going to happen, and feeling as though they might lose control of themselves. Anxiety is a prominent feature of bipolar disorder in various clinical settings and can actually make recovery more difficult. So adding this specifier helps with that treatment planning and monitoring of treatment response. So it can be really useful for providers. Another specifier is with rapid cycling, which can be applied to bipolar 1 and 2. And this means that there have been at least 4 mood episodes in the previous 12 months, so 4 episodes in a year that meet criteria for manic, hypomanic, or major depressive episode. A third specifier is what we call with atypical features, and this captures those people in a major depressive episode whose mood brightens in response to actual or potential positive events. Other features must also be present for this specifier, such as issues with weight or sleep, a pattern of sensitivity to perceived interpersonal rejection, or what's called leaden paralysis, which means heavy feelings in the arms and legs. Many people who are diagnosed with both bipolar disorder and borderline personality might actually be just bipolar disorder with atypical features. If your mood changes quickly within the same day or the same hour, this is usually classed as a mixed episode rather than rapid cycling. Again, a thorough clinical interview to explore patterns and deep dive into history, including any trauma, as well as other symptoms of BPD, can help ferret out whether this is a mood disorder or a personality disorder. Fourth specifier, with peripartum onset. Peri means around, so around childbirth, whether before or after it. This is added if the onset of mood symptoms occurs during pregnancy or within about 4 weeks following delivery. Another specifier is with seasonal pattern. This applies to the pattern of a person's mood episodes over time, and it can apply to just one or multiple types of episode within the same person. You're generally looking at the last 2 years when you're considering this specifier. So this could describe someone who consistently gets depressed in the fall or winter, or someone who becomes manic in the spring. So those are 5 of the 9 specifiers that can be added to the bipolar disorders. Those are the ones I personally have seen most often. For those of you who are interested, the other specifiers are with mixed features, with melancholic features, with psychotic features, and with catatonia. If you want more information, you can search bipolar disorder specifiers online. Thanks for watching. See you next time.